Today, a very personal problem for women. It's pelvic pain with intercourse. Our next guest says it's common, but you do not have to live with it. Stacey Roberts is the owner of New You Health and Wellness. She is here with help. Hi, Stacey.
Hey, Molly. Good to see you.
Good to see you, too. Do you find that a lot of women are reluctant to talk about this subject?
Men and women, but especially today we're talking about women in chronic pelvic pain, and specifically with intercourse. It can be something that many women just take as normal, right? But even though it's common, up to 20% of population for women would experience it, or at least chronic pelvic pain. And up to 40% at one particular primary care clinic of women had chronic pelvic pain and some related to intercourse. So we just think it's normal, so we don't talk about it. And if there's no treatment for it, then, people just shrug their shoulders and just live with it.
Yeah, I was just going to ask, I bet by the point that you talk to people and they're doing something about it, they're at a point where they're like, oh, I thought this was something I just had to live with.
Exactly, 100%. And those who have doctors who are more aware of what's available, we'll potentially send them to physical therapy, which is fantastic. There's a lot of really good pelvic floor specialists that can help. But in our case, sometimes that doesn't help completely. And we had a situation where we had a young woman who had been married for, 8 or 9 years, and she was having pain, so much pain with intercourse that she stopped having intercourse over the last 5 years of her marriage. And it just obviously became an issue with her marriage. Although they stayed together, it was still a contentious issue. And she had physical therapy and then came to me, and by a good physical therapist too, and then came to me and we did the shockwave treatment along with other physical therapy. And it was miraculously, really, in 3 treatments, she had absolutely no pain. Really, after the second treatment, she had no pain, but we both were a little bit nervous to say whether it actually would have worked that quickly. So she had 3 treatments, no pain, and I spoke to her, and it's been 4 or 5 months since she's had any pain. So it's just been fantastic.
That must be so encouraging for everyone out there who's listening to you right now, who thought that they were in that category where they just had to live with it and they're experiencing so much pain that they're avoiding it altogether. Before we get to more about the treatment, what causes this type of pelvic pain?
It can be caused by many different things. Hormonal changes can be one. In this particular incident, the woman had an IUD inserted years ago, and shortly after that, she started to have the pain. We don't know if that was directly the issue, but it was around the same time. So there could have been also a hormonal shift that contributed. And then once it started to hurt, unconsciously, you kind of tighten up in the pelvic floor. If you guys remember that down in the pelvic floor here, there's a ton of muscles in that area. So that can contract and then just not let go and make it very difficult for intercourse at all. Other things could be sexual trauma in their past, or trauma to the area through surgeries, or chronic pelvic pain from period pain issues. So there's a lot of different things that can go into it.
So tell us again about this treatment. This is so exciting, especially for the woman that you mentioned that got so much better after 2 treatments and for sure by 3. How is it different maybe from regular physical therapy or whatever other doctors might be using to try to treat the problem?
Absolutely. So there's some doctors who will try to utilize medication for the issue. And if that doesn't work, they may send them to physical therapy. And then a pelvic floor physical therapist oftentimes does an internal check to see what muscles are being effective. And then they'll give them some exercises and utilize something called biofeedback at some points. And if the muscles are really, really tight, then they'll use something called dilators to help stretch the muscles out in that area. And that was all done. And again, that can work for some people, but it worked for about 3 or 4 weeks after she had that treatment for 8 weeks time. But then it came right back gradually over a period of time. Whereas now she's been away without pain for almost 4 or 5 months now, which has been fantastic. So what's different about this is it penetrates deeply into these muscle structures. So this is the only modality that I've ever seen that penetrates to the depth of like a soup can without causing any physiological damage. It brings blood flow to the area where these muscles are red, they're full of blood. So it brings increased blood flow to that area, which allows the treatment that I do manually to be able to work and be much more effective. And then along with those exercises that she was already taught, we combined all that together, and she's had a fantastic result.
It's incredible. I have a testimonial right here from JM of Milwaukee to protect privacy. You can see the full quote there on your screen, but it's incredible that she says after seeing you, Stacey, she learned about the software technology. She was amazed, she said, at the progress after just a few short sessions that's been maintained over time with no regression. I think that's so important. She said she's gotten to the point where no pain exists with intercourse, and she's so happy to have found you at New You, which that just must make you feel so good that people are really having such incredible improvement.
It's something, I've been a physical therapist for 30 years, Molly, and I have not seen this type of improvement with a modality ever in my years as a physical therapist. So every day I'm excited, whether I'm treating a shoulder, a knee, a back, men for erectile dysfunction, any type of pelvic pain. I'm just so excited because this is something that I truly haven't seen be this effective, this quickly in the many years that I've been practicing.
And truly life-changing and relationship-changing. We ran out of time, but very quickly I want to ask if it's painful, if the treatment that we're talking about is painful.
Absolutely not. As a matter of fact, if they have pain with the treatment, we refer them out to see what potentially is causing the pain, because this treatment is absolutely not painful when it is used correctly. And on the area, when we're talking about pelvic pain, musculoskeletal can be a little bit uncomfortable, but if there's pelvic issues or erectile dysfunction, absolutely no pain with treatment.
That's so important to know. Thank you so much, Stacey. So encouraging.
Thank you, Molly.
Absolutely. Great talking to you. And right now there's a great introductory offer of just $79. That will give you an abbreviated treatment so you can see what it's like, as well as a consultation to make sure that this is the right treatment for you. So give them a call today, 414-299-8121. You can also email them at this address. It's newuhw@gmail.com. You can also visit their website. It's newuhealthandwellness.com and download an ebook.